Let's head to Otago University, where a student is urging the organisation to be more open about suicide to aid prevention efforts. Now, RNZ has learned 5 Otago students are suspected to have taken their own lives in the past year, as well as several others connected with the student community, though that has not been confirmed by the coroners. The number of students needing mental health support has also surged at the university. Here's our Otago Southland reporter, Ian Telfer.
A 4th-year English student at Otago, Jean Bouchin, has had personal experience of suicide. Her brother, who was briefly an Otago student, took his own life 3 years ago, and she wishes she'd done more for him. Ms Bouchin went on to suffer from anxiety and depression herself while at an Otago Hall of Residence. She says it was a big jump from high school to university.
You have to constantly keep on top of your readings and your studying and like your lab reports and the like. I wasn't doing health science, but I was doing a number of health science papers, and the level of competition, especially within my hall of residence, was extreme. It was excruciating. You had students comparing their test results in the hallways and in a passive-aggressive manner as well. That wasn't great.
Ms Bouchin says the suspected suicides this year have shocked the campus.
I don't personally know any of the students who have passed away, but I have friends who are really close to them and who are really cut up by what happened. What I've heard has just been about hearsay around the university. There's been no official publication or statement by the university or any of the departments.
One of the university's chaplains, Greg Hewson, is part of the suicide prevention front line, counselling students and helping them get support when it's needed. Reverend Hewson says it's been a bad year for suicide around the university community, but no one is quite sure why. However, he says the impact on students and staff is enormous.
There has been an increase, particularly this year, in sudden unexpected deaths, and this has had a mental health component in some cases. So often we're seeing the tragic end result sometimes of this increase in suicide in our New Zealand community, and that has sadly been evidenced in our own university community this year.
Mr Hewson says there's good evidence that the church, the mosque and communities of all faiths have a crucial role in nurturing spirituality and building mental health. But there's also debate about risk, with some research suggesting that too much openness could lead to increased suicide. There are strict reporting guidelines for media too. Student Jean Bouchin says Otago takes suicide seriously, and there are a lot of good initiatives going on, but it needs to be more open.
I think there should be definitely more transparency about what's going on and confronting the facts of the matter. To me, anyhow, silence, covering up things, only increases and perpetuates the stigma surrounding suicide and other mental health issues. It's important that we facilitate a productive discussion, one that's helpful.
Otago University's declined to comment, saying the situation's too delicate. In Dunedin for Checkpoint, Ian Telfer.